He does,
Oh, yeah.
he does
Biochemistry. I see. Wow, that's good.
Not to your camera, you can't even see camera. Man.
Now go
take picture.
I'll tell you. Yeah. Wow. Good to see you finally. Thank you for You saw the post?
Yeah, the first time I saw it.
I see it. Yeah. So let's go. You know, no. Let me take my son in the office first. Yeah. Let him see where I work.
Yeah.
Come on. This is where I am.
See that? Yeah, imagine.
What?
Office table, living room table. Hey, man.
So I don't spend the time here. I spend the time in the lab also. Yeah, I got two different areas. Yeah.
Liberia, we should go
I spend the time in the lab
JZyNo
most of
pay
the
the
time.
courtesy
Over the
call
whole weekend, I
on
was
the
in
Director
local
General
meeting
of
with
the
the
Liberia National
diagnostic
Public
team.
Institute of
Yeah.
Liberia,
Have a
Dr.
seat.
Dougheh Chris
Have a seat.
Nyan.
Yeah.
Today,
Yeah. Have a
Thursday,
seat. All those, you see, all
22nd.
the fine chairs, I don't really sit on them. These are my kind of chairs that I sit
in the
on.
office of the
That's why I got it here
Director General,
for you.
along with
Yeah.
the Central Rack,
And this is where I usually sit.
on
That
the
big chair you
Director
see, I
General.
had to sit inside.
So the Director
Now,
General
that's
is hosting
not the
today.
kind of chair I'm used to
The
sitting
Director
in.
General is hosting
Yes.
JZyNo.
I told her, I said, you're bringing laboratory
Outstanding
chair.
outcome.
Let me sit in, put it over there. You see, my
NPL
microscope
offices.
is still just behind there.
Yeah. The last time I saw that, I think it was
I'm nothing.
2009?
Yeah.
2008, 2009.
Wow.
Last time I saw
You saw microscope.
Quincy Mary's. Yeah.
I see. Yeah. No, but congratulations on your progress and your success from where you came and from where you are now. Those of us who have been in the diaspora, outside of your own country, we know how difficult it is to operate in certain terrain.
Right.
I mean, you've carried the Liberian flag so well, and I know what that struggle is. I went through that myself, so I really appreciate the level at which you have elevated the country. That is why, in fact, I'm a lover of all types of music. I play some instruments too in the past, but with work and other things, if you don't constantly play, you depreciate it. Yeah. And so when the hit came out, I mean, the way the music is arranged, I really did appreciate it. Because when I listen to music, I look at the instrumental, how each instrument comes in, how the voice comes. I told all my people, I said, this, it's not because, before I even knew you were on Liberia. Oh, wow. Before I even knew.
You knew my song before.
I knew the song and I, put it out there and those kind of things. So congratulations. I'm so glad to see you.
Thank you, my boss. So I'm gonna be here and meeting you. Man, I wish I was there with my little brother Frank. He loves you so much,
There can be a second visit.
Yeah, when I'm back, I will try.
Oh, okay.
As long as you're around to try to get him to you.
Right.
He loves what you do. Yeah, inspired by what you do.
Yeah, so I understand you went to get the vaccine and
oh yeah, I went there.
Yeah.
Because I didn't know much about it until they explained to me. It's I think misinformation will get people panicking and they're afraid to even interact with their own family.
That's correct.
The vaccine I want to take, the lady's like, no, you don't need it. I'm like, how? Like, sometimes I be protected. I just said, no, you can protect yourself by washing your hands and just be very careful how you get in contact with certain people. Now, you are not in direct contact with the host or an infected person, so you don't need to worry yourself. So I'm like, okay. So when I went to see Jabate, they prepped me well, and I went there. They didn't touch anything. There was a space between us. Just had my hand footed, talk to him, encourage him, because it's a thing.
Right.
Some people didn't understand it. Just felt like maybe I came to Liberia, on the whole social media thing. I haven't been well, because of stress.
Yeah.
It's lonely out there. left my family here over 10 years. You know, was in Ghana struggling.
I know.
See, it's not like, oh, I started, family had money to take me places.
I
Now
know.
I had to do my own thing from husband to waiter to whatever.
Yes.
But the dream was just to become something better in society, you know, as a Liberian.
Right.
I had better opportunities out there back then to be a Ghanaian or to be the other person, and I refused that. And still hustle on my own to become something better for my country. You know? So this guy, Jabate in person, is someone who entertained us.
That's correct.
You know, and God forbid if we lose this kind of person, we'll all cry. And where he is, he's lonely. That's why he does Facebook Live all day. He feels like he's away from the reality. He's away from everything. You see, he'll be doing live in tears will be in his heart.
Yes.
So I just thought it was like, bro, I know it's risky, but let me go there. Let me just encourage this guy. And I pray about it. I know how risky it was. Pray about it, and I asked these people to take care of me, to get in there. I just want to have a word, you know, word with him.
Right.
And then I encourage him, you know, bought some stuff from the supermarket, me and my boys.
Right.
We went there and they encouraged him. And then he talked to me on the phone like, man, believe me or not, you come here is like the whole Liberia came to see me. You get it? It's not just some friend from the community, no. He said it's JZyNo, someone who I love so dearly. I'm like,
That's
bro,
correct.
I started loving you before you started loving me, because I'll be watching your stuff here like, Jabate, you know, behind the walls, teaching the little girl how to face the love sign, then they call the little girl, where are you, Toya? I said, me, Jabate behind the wall, doing why we're making love, you know. So yeah, those funny things, you know, cheering up. Yeah, but I just want people to understand that it's not something that we should be afraid of.
Right.
You know, we should just find a way to protect ourselves. That's
Definitely.
all. You know, that's all.
No, thank you so much. And in all of my conferences, press conferences, and even in our major meetings, and today I was with the Africa CDC, and I was telling them about the whole thing, that I put him on one whole big slide. Everybody saw him. I said, this is our celebrity, who is now carrying our messages, Jabate. And I said, we've been messaging before. How did he know that he has a disease? Because he heard it.
Right.
He said, this is what I got. You people be careful. I beg you. You do this. If you feel this thing, go to the clinic. You know, he said all those things. It's because of the little messages we've been sending out.
Exactly.
And when it happened to him, he knew immediately almost what to do.
It would have been way worse.
It would have been worse.
Yeah.
And then he didn't say, I'm going to harm myself.
No.
So I call him one of the most patriotic Liberians that I've ever come across.
And what he did
Now,
was very good by coming out.
Very good.
Right.
You know, and I've said it. And the president himself, when I reported to cabinet, same thing I said to them. When I reported to the legislature, same thing that I said. This is what we call patriotism.
Yes, because it starts from one person.
It starts from one
and then
person.
it destroys the entire country.
Now,
Yes.
all the things we have been doing since this outbreak, some people were there denying it, but now, look how far the message has
Based on
gone.
politics, I've seen plenty of things on the internet.
People have done politics.
Based on that to
Yeah.
So, I mean, it's scary, but
Yeah.
we just
You
need
know.
to.
But you people can rest assured that we're doing the best we can from the Public Health Institute. We have very good experienced people here that have been, you know, handling diseases outbreak, including myself. And so we're doing everything we can. We're just yesterday at the Sierra Leone border. That was the second time we went there.
How is the case issue there?
Well, the case out there in Sierra Leone is not good. Yeah. And so as a sister or brother country, we strengthening the border, help them out, and provide whatever services that they need, because they may be overwhelmed. There's too much for them. So we are saying we are right here. If you want us to do some diagnosis for you, just send the samples to us. You don't got to fly anywhere, just across the border. We'll do it and we'll send the result back to you. You want to do the thing we call gene sequencing, you know, where we know what it really is. Yeah, that technique. So we say we can do that for you as quick as possible, and we can send you the result. If you need manpower, we also can mobilize some of our manpower here and send them over to you as well. So what we'll do is strengthen the border so that we don't have the back and forth. And so that's what we have been able to do. Tomorrow, we will go again to the other border points around Lofa. So yesterday we were at Cape Mount. Tomorrow we're going towards Lofa along those border points to strengthen our response there and the response on the other side. So we distributed some materials, information materials, and infection control materials. So that's what we did. This is Alberta Cover. She's the deputy director for the Division of Infectious Diseases that does the response. And he's one of the senior scientists here, Dougheh Chris Nyan. He helps with research and then diagnostics as well. So, but we really want to thank you. I know we knew each other far before this time, from our own social media association and music arena. And then when I heard and saw that you were in town, I said, we got to, I got to see you, we got to meet. And we've been saying it, that, we'll meet at some point, And look at what has brought us. Freddie Fred, how are you?
That's my boy.
Come and have a seat.
I do. This is my praise scientist and my celebrity talking so.
So
I want to also know, do you think this outbreak that happening on Sierra Leone, you think it caused from the here?
Not necessarily. We had it in the region. That's what we can say, okay? It's in East Africa, Democratic Republic of Congo, Rwanda, it's in those countries. Then it's here too. Because we got a same kind of forest situation.
Well, it's actually for monkey.
Yeah, the first time we saw it in monkey. That's why we gave it the name monkey. That was the first time in 1958. Long time ago. Because it was in the monkeys that were being transported somewhere and they saw these rashes, on the monkeys.
You think it was some medical research that got it? Like some scientific move that got it? Or maybe the way they got sick by themselves, like how we can get malaria and stuff.
No, they just got, let me say something. You see, all these diseases that we are confronted with, these diseases are older than some of us. Yes. They are older than human beings.
I believe that.
They've been around.
I also do believe that God sent some dying and then been here.
Because
look at it, you see all the plagues and stuff like that.
So, the science people say evolution, with the religion people say creation. So from the time of creation, from the time of evolution, they've been here.
Solomon said that nothing beyond the sun.
Nothing beyond the sun. Exactly. But the fact is that we disturb all the places that this thing is supposed to be, right? All the logging, deforestation, then the mining, illegal mining, all these things, they are not controlled. So imagine monkeys now coming to town because we're destroying their habitat.
Yeah.
So when they leave that area where they were and they come somewhere else, those little diseases that are in there, mind you, we got these diseases in all, but they don't cause any trouble.
Exactly.
We got some diseases, pathogens we call them, but they don't cause any trouble. They live with, we live with each other. Wow. We benefit from them, they benefit from us. Wow. Now, when their environment is disturbed and they leave from there, they have to adapt. So what's in them to have to adapt? Now when it adapt, it doesn't fit in that environment, there is escape from there and come to humans. That's how you see it comes from those bats, monkeys, then it comes to us. That's how we, when it comes in us, it has to also adapt because that's not where it used to be.
Exactly.
We call that genetic change, genetic mutation. So when it change so that it can adapt, that's how we get the disease. So that's what we see with this thing. 1970, that was the time we first detected it in Liberia. Yeah. Oh, wow. So from that time, it's been like one time. Just one time. But then during that one time, it was doing what it could in order to adapt more.
Over how many years?
Exactly.
Over 50 years.
Over 50 years.
Yeah, 50,
Right.
almost 55 years.
So around around 2021, 22, when we had a COVID, it took advantage of that too to start doing Then it started coming out, and when we started detecting it every time.
Okay, that means it's in the system.
It's in the system. So now,
it's in the system.
You see, they take advantage of each other, right? And they take advantage of condition created by one person.
It's true.
So after COVID, now it's in my time now. They started coming out in Liberia, in DRC, Congo. Then it started coming out all over the world also because we travel these days. You know. So in the US, in Europe, that's how now the whole world say, let's handle this thing here before it get out of hand like COVID, or the way Ebola was out of hand here. And that's how the WHO and the African Center for Disease Control declared it as an emergency. So all of us had to respond to stop it. So Liberia has been responding since August, officially since August when it was announced. Yeah, all the, yeah.
August 2024.
Yeah. August 2024, yeah.
Mm-hmm. Yeah.
Since
we
that
have been
time,
fighting though.
we've been fighting, yeah.
We've been fighting.
So other countries, from the reports that today we reported to the whole continent, currently we have 25 active cases.
In the entire country.
In the entire country. Because the press have been asking to make the call, but Sarah, you know, we said, okay, we'll give you the comparison. You know, we're not happy saying that, but that's the fact. Sierra Leone has almost 2,000 active cases. We have only 25. And you know, because we've been beating it
Ghana
down.
has surpassed over 200 now.
Ghana?
Yes, I saw something. I saw
Yeah,
Ghana is
yeah,
reporting
Ghana,
cases.
Yeah, I
yeah.
saw it.
And we've been responding to this thing long time. We got, you know, we got infected.
Imagine.
And we've been really working. You see, all these folks, they've been,
They're strong.
yeah,
They're strong.
you know.
Yeah.
At some point, we had 0 cases.
Wow.
We beat everything down. All the cases recovered. In December, we had 0. But we didn't relax, you know. In January, it started showing itself again until like March. We beat it down again. The whole month, we had 0 cases.
Working on them go
Yeah, they will.
That's what we've been doing.
public
See that Java?
No.
That remove other person like COVID or less than even 10 in the entire public already panic
Exactly.
the messaging between
Exactly.
and the public.
Exactly. So what we've been trying to do is to do our messaging so that we don't create panic, but address the situation appropriately. That's why sometimes people didn't even know that it's here.
Yeah.
Certain places I went, I asked, I said, do you know monkeypox is here? They said, no, I don't know that thing. I can tell, I said, yeah, but we've been dealing with it. You know. So that's how we've been handling, not to create panic, but to address it and stop it. And that's why with the help of all the little technologies we have, we put our ideas together and we've been handling it the best way possible, for which we have the record that we have. And we pray, you know, to God and our ancestors that will keep, you know, suppressing it, keeping it down so that it doesn't go from person to person. So the next thing is the vaccines. So the Africa Center for Disease Control sent us some vaccine when we requested that. And the vaccine we want to first give it, according to our program, to anybody who is connected to an infected person. Because that's a direct line, you know. So you want to, what we're trying to do is to, you know, build a wall. Because if anything happened with those people and we don't build that wall around, you will escape. You see the strategy we're using? But you who are not connected with any infected person, there's no need to worry.
Safety without waste, right?
It's not
Yes.
a waste, yeah.
It will be a waste.
Yeah.
You see? And our country don't have enough money to buy all these vaccines. We're getting them free, so we give it free also.
Otherwise, the town will need it, we may not get it.
We may not get it.
Why do we say when people
Yeah.
who are not even affected?
When we come out, we're not doing something.
Yeah.
I mean, I have
So-
over a million social media
Right.
followers, so we can do that. We can
Definitely.
also use our platforms.
Right.
At least on video, or
It's
as
not there.
I
It's not there information on Slack here that okay, we don't have enough of the vaccines.
Yeah.
So you guys who are not affected,
This
these are the
information.
procedures
Yeah.
you put
Yeah.
in place to stay safe.
Yeah.
And the vaccines are directly for people who are already
Yes.
infected.
Right.
But they say, oh, the vaccine are enough, so we can't get anybody. It doesn't.
It doesn't complete it.
And it even makes the other person that drive from far out to come angry that
Yes.
all the people say on the
Yes.
radio that the
It's-
vaccines
it's-
are free, you can come for it.
Yeah,
You not get malaria, but you want
Yeah.
malaria medicine.
Right.
But
Right.
yes, your sister get malaria living in West Point.
Right, exactly. As simple as that. That's how it is. So what we are trying to do is, once we, now, you see, we're trying to even change our vaccination strategy now. What we're trying to do is to go to the border and vaccinate people there.
People that rate,
Right there.
that will bring it into
Connected.
easy.
Yes. You see?
Sure.
To build that barrier right
So
there.
you're protecting the entire country. not
That's
just
correct.
here.
It's not just, you know.
Sure.
So we got people watching, what we call surveillance. They are there looking to see who got temperature, who got rash on them. As we cross the border, they look at that. when people are crossing the border, we made them to wash their hands with the soap and the chlorine water, so that if it were on your hand, it will kill it. So that when you mistakenly, you shake somebody's hand, it's not on you, because it's personal contact through which people get it, mainly. So those are all the strategies that we are using, and we go on air. I just came from ELBC today on their Tuesday MICAT press briefing. So the whole country, they listen to that, because it goes to all the counties on different radio stations. Yeah. So that's what we do. So thank you very much. A lot of celebrities, and I was telling them, I said, when I was presenting to cabinet, I said, do you know Kevin Hart? One person said, yeah. I said, okay. If Kevin Hart got COVID, you will see how it will be all around. Yes. But if an ordinary person get COVID, that's an ordinary person. You don't know them. That's our celebrity, this Jabati. That's what I told them. I said, you see how the information is all around? It's fast spreading. It's fast spreading. I said, so he's one of the patriotic sons that we have. And we really appreciate him. I have plans going there to visit him. Yeah, I will do that. You have to. I will, oh yeah, I will. I have the plan. But we want to build that barrier, put those checkpoints in place, and then we start to do that. Yeah. So that's where we are. So most of Kobasi waited for me when I was at the press conference, at the cabinet meeting. He waited for almost 5-6 hours. He said, Dad, I was waiting for you to come and prepare. I want to, help with the sharing the word.
But everybody thought that the health ministry, they pay me some of that money to go through what I did. Yeah, because that thing, that one made it news. For example, everybody thought that I've made some kind of big money.
You know that how people think.
I never reach out to anybody.
No,
because I was thinking about the country, and also.
But I was calling names. I also called your name to phone. I said, I wish my boy JZyNo was around. Not knowing that you were already here.
Yeah. For example, after we go with everything,
right?
You were short promotion.
I washed my hand. I did a video.
That's right.
But I told you to keep that video. I told you to keep it. I didn't put it out yet.
Oh, okay.
I put that video out. I was charging 15 million.
I'm telling you. That's intellectual property.
Yeah. Oh yeah, but
see, so I was telling people not to panic. Because I took the information very clearly when the nurses were telling me what is right, what is not right. Based on the vaccine, what I have to do, what I have to do. So I took the information from them, and then I passed it through this video. Because it's getting people afraid.
It's getting people afraid, that is true.
I met people out there. And then they want to say that, I'm in there.
Yeah, no, and that's what we're saying to them. Don't,
We're even having a game Saturday, for my people.
Okay.
The bloggers, the comedians.
That's correct. Gary the blogger, I got in contact with him. We got in contact with each other far before.
Thank you. Oh yeah, I need those help, buckets where they can have you open in the water can wash your hand. I need at least 3 or 4 for the ministerial complex.
For the ministerial complex.
I call them invisible pack.
Invisible pack. Okay.
Because Saturday will be very.
That's Saturday, right? Yeah, Saturday, like I said, tomorrow we're going to the border, so I may not be there on Saturday.
You don't know be there. Our president will be fair.
Amen. So we're going to do the other work on the other side, and when I come back, we'll get together again.
Now you guys are soldier.
Arriving in that Saturday or early Sunday morning.
Okay.
I came over just 5 days.
I see. Okay. Well, it's good that we finally got to meet and in person, and whatever little promotional thing that we can do together, we'll do it. Before I leave and escape tomorrow. I'll be here tomorrow. I will be in the main meeting that we can hold to design all the strategy. One of our meetings we put it on Facebook so that people know how so that people know how we discuss, how we argue with each other. No, we're supposed to be doing this one. No, we should be doing this one. No, the people are thinking this way. Because people don't know what goes into these decisions. They have to know. We serve the public. So that's so thank you so much for again raising the flag, just as many of us and others have done out there. Same thing, one could have done this or that, but we gave that up and said no, the country is my interest. So yeah. Well, thank you very much. Good to see you. Ready?
Yes, sir.
Yeah. Yes. So Yeah. So these are all our some of the materials that we took around that you can take with you. So this is here how to prevent Mpox virus. Yeah. And then we got the flyers. We got some little flyers here, different type of flyers, and then this one is a flyer that open up. So yeah, you take that with you.
Yeah, again, shopping at me this time from this day to this time. Money for the shopping, money for the impossible.
Yeah. So like I was saying, monkeypox virus. That's the virus. Then the disease is called Mpox for sure. Just like the previous pandemic, they say COVID-19. The actual thing that COVID-19 is the disease. Then SARS-CoV-2, that's the virus.
Oh, wow.
Yeah. SARS-CoV-2. Then we call it short. Yeah. COVID-19. COVID-19. So Mpox. Yeah. So these are all the materials. Thank you so much for coming. Very well appreciated. We can go in the other room and do, all of the photographs. Yeah, we can carry this one.
So thank you for watching.
So, social media. Yeah. Have a seat here.
Yeah.
Focus after the count of 3. 1, 2, 3. Combo. 1, 2, 3. JZyNo say Mpox is real. Avoid in contact with anybody.
JZyNo!
Thank you so much. We have come to the end of this broadcast. JZyNo paid a visit. I want to say thank you for watching. Please share the platform. Thank you so much.
One more JZyNo. Please, good.